Welcome to This Explainer. Today, we're looking at a truly urgent story of saving lives through community health. We are talking about Healthy Futures Global and their fight against silent killers in Ghana. We're going to see how a highly targeted, grassroots initiative is taking on some of the most dangerous hidden threats to human life out there. And honestly, it's amazing how a remarkably small intervention can completely rewrite the course of someone's future. Let's get right into it.
Okay, let's dive into this with a quick question. What can you actually accomplish in exactly 2 minutes? You might boil a kettle, fire off a quick text message, or maybe scroll through a couple of posts on your feed. But in the context of the health crisis we're exploring today, 2 is a magic number. Because 2 minutes is the exact amount of time it takes to do a simple blood pressure check.
Think about that. For someone walking around with undiagnosed high blood pressure, taking that tiny 2-minute pause out of their day isn't just getting a basic health metric. It is literally the deciding factor in adding years, maybe even decades, to their life. This whole explainer is built around that one powerful premise. By spotting a problem in just 2 minutes, a completely preventable tragedy is stopped dead in its tracks. But to really get why this 2-minute check is so desperately needed, we have to understand the enemy we're up against.
So that enemy falls under the umbrella of NCDs, or non-communicable diseases. We're talking about systemic conditions, right? Things like high blood pressure and diabetes. These aren't infectious bugs you catch from a cough. And here's the truly terrifying part. They are completely silent. In their early years, as they're quietly damaging blood vessels and vital organs, there are absolutely zero warning signs. None. You don't get a fever, you don't get a rash, you feel totally fine, while this massive health crisis is just lurking right beneath the surface.
And this brilliantly illustrates the shocking reality happening across Ghana right now. Just look at this split. Non-communicable diseases are now responsible for almost half of all deaths in the country. Let that sink in for a second. Nearly 50%. Historically, global health work in West Africa has been heavily focused on infectious diseases, but the data is loudly telling us that the landscape has fundamentally shifted. The silent killers have taken over. And because they're silent, most people have absolutely no clue they're living with them until it's just way too late.
Because there are no early symptoms and no red flags, the devastating late-stage consequences basically become the diagnosis. It's a tragic reality. The very first sign that someone has one of these diseases is often a catastrophic, fatal, or totally life-altering event. A stroke, kidney failure, a massive heart attack. Can you imagine discovering you have high blood pressure at the exact moment it gives you a stroke? It's devastating for the individual, it breaks families apart, and it puts a massive burden on the whole health system. All from something that could have been so easily managed if it had just been caught early.
So, let's zoom in from that national data down to the local level. Specifically to a place called Asamakese in the eastern region of Ghana. The source material highlights this incredibly profound quote. It points out that thousands of people here have literally never had their blood pressure or blood sugar measured, and it's absolutely crucial to understand why. It is not because they don't care about their health, it's because screening simply isn't within reach. This is an infrastructure and access crisis, pure and simple. The desire to be healthy is 100% there, but the physical means to actually get checked, they're just absent.
So the crucial point is, solving this access crisis without just creating dependency requires a completely different mindset. And this brings us to Healthy Futures Global. They're a UK-registered community interest company founded by NHS clinicians and healthcare leaders who actually have deep personal roots in Ghana. They have fundamentally rejected what we call charity parachuting, where well-meaning outsiders drop in for a quick, one-off gesture and then just leave. Instead, their solution is entirely community-built. It focuses heavily on prevention, it's delivered by local clinicians, and it's deeply connected to continuous, long-term care.
Let's break down the actual mechanics of this sustainable model, because it's pretty brilliant. Step 1, they bring free checks directly into community hubs. They take the healthcare straight to where people are already living, working, and worshiping. This removes all the friction of travel or cost. Step 2, these screenings are delivered by local nurses and health workers, which builds immediate trust and capacity right within the community itself. And Step 3, which is arguably the most vital piece of the puzzle, anyone with a raised reading gets a direct referral straight into the local Ghana Health Service. So it's not some dead-end diagnostic. It is an immediate bridge to continuing care.
This whole approach is perfectly summed up by their promise to the people of Asamankese. Your health, your choice, your future. By giving folks access to that simple 2-minute check, they're giving them a choice. because early detection means an individual can manage their condition with low-cost medications and just some simple lifestyle changes. They actually get to take control of their future, rather than suffering a sudden, terrifying hospital emergency years down the line that just strips them of all their choices.
Now, what's really interesting about this slide is the sheer attainability of this mission. 4,760 pounds. I mean, in the world of global healthcare, we are so used to seeing figures in the millions or billions, right? But this right here is the exact total financial goal Healthy Futures Global needs to equip a campaign capable of screening up to 2,000 people. It is an incredibly focused, highly efficient economic target that proves massive impact absolutely doesn't require massive budgets.
And on top of that, they offer radical transparency on exactly where every single pound is going. Because they're a not-for-profit volunteer team, 100% of the funds raised go directly to purchasing equipment. Whether we're talking about sampling lancets, blood pressure machines, point-of-care devices, or an ultrasound, they account for literally every penny. And the real beauty of this? The equipment doesn't just pack up and leave when the screening campaign ends. It stays in Awesome and Casey permanently, continuing to serve the local community day in and day out.
To really wrap our heads around the power of this grassroots funding, let's do a quick, rapid-fire breakdown of the impact. Let's start with just 5 pounds. That is the cost of a fancy coffee in a lot of cities. Well, in Asamakasi, that same 5 pounds buys the sampling lancets and necessary consumables to safely and cleanly screen 8 different people. That is 8 individuals who will finally learn their numbers, all for the price of a hot drink.
Scale that up just a tiny bit to 35 pounds. That amount pays for a testing machine that can process more than 200 blood tests. We are talking about identifying blood sugar levels, cholesterol, and anemia. This is the exact hardware required to catch diabetes long before it ever has the chance to cause irreversible organ damage.
Let's move to and see how this builds. Stepping up to 50 pounds buys a clinical-grade blood pressure machine. Now, this isn't some single-use item. Over its lifetime, this one machine will be used to check thousands of people. It will literally be the instrument that warns a mother or a father that they're at risk of a stroke, giving them that vital, life-saving window they need to seek treatment.
And if we look at a 150-pound donation, the impact is just astonishing. That amount completely equips an entire screening station. It provides the blood pressure monitor, the blood sugar testing kit, and the weighing scales. It's the whole shebang, everything needed for a comprehensive check run entirely by a local nurse. You are essentially funding a pop-up clinic capable of triaging an entire neighborhood.
Finally, looking at the largest single item on their transparent budget, 1,400 pounds for an ultrasound machine. This one singular piece of equipment will be used to screen over 200 pregnant women, instantly catching and excluding potential complications for unborn babies. But just as importantly, it supports the long-term clinical training of local midwives. It's fundamentally building clinical capacity and resilience in a low-resource setting. It is the perfect example of this urgent story of saving lives through community health.
Because Healthy Futures Global is a small, volunteer-run, early-stage organization, the mechanics of giving here are just very different than with those massive international NGOs. As this incredibly powerful quote from their campaign states, your donation isn't a drop in an ocean, it's the difference between this happening and not happening. Every single lancet and scale is bought because someone actively decided a stranger's health was worth a few pounds. There's no massive corporate buffer here. Your action directly, literally translates to a medical intervention.
Which brings us to the ultimate provocative question posed by the clinicians leading this charge. Will you help someone learn their numbers before they become an emergency? We've seen how silent these diseases are, we've seen how devastating the late-stage consequences can be, and we've seen exactly how affordable the solution actually is. The infrastructure is ready, the local nurses are waiting, and the community is incredibly eager. The only missing variable is the equipment to make it happen. Thank you for joining me for this explainer. I really hope this deep dive into community health in Ghana leaves you thinking about the immense, life-changing power a simple 2-minute check truly holds.